So today I want to take you to one of the documentaries we did where you'll meet one of our patients, Marbeth, who's going through a really distressing life experience. So to underscore this topic succinctly, we're going to utilize some of the documentary footage I've done earlier to really drive home the benefits of this approach.
It was 3 weeks ago today that my firstborn son died from an awful bacterial infection. It was like a tsunami coming at him. He was 41 years old, and father of 2 beautiful twin little girls, 4 years old.
After experiencing pain, Marbeth's son visited urgent care, where his x-rays seemed normal and he was given antibiotics. His condition deteriorated rapidly, leading to an ER visit, 2 surgeries, and an emergency amputation. Despite these interventions, he passed away in less than 3 days.
And he was the most kind, generous, intelligent. He was an incredible patient teacher to everyone around him.
She's the one who made her a mother, and what that was like to have to let that go before she was ready, with no warning, no expectation. It was completely unexpected.
The end of the world has been on my mind. How do we get to the other side? Tell me that
God created him and made him this wonderful person. And why did they take him away? And I have a strong faith, and I believe that was God's plan, but it's just a hard one to accept right now.
Well, I know that you've had a couple of conversations with Dr. Tobia, so now she wants to help you with that next step of doing the NET to see if she can help you alleviate some of the stress of this terrible, terrible thing that happened. In practicing NET, Dr. Tobia has to employ Sherlock Holmes-like diagnostic skills to explore how the traumatic experience is affecting Marbeth's body and mind. Remember, trauma is not what happened to you. It's how you carry the load or burden of the experience in your neurology, and how that gets expressed in the rest of your body. And everyone is different in that regard.
So I know when you go through something like this, everybody in the family can be affected differently, and that it can have an impact on everybody. And I know as the mother, you often carry the weight of all of that. So can you just feel, and as the wife, how everybody's impacted by everything that you guys have been through in the last few weeks?
Dr. Tobia's first task is to understand the patient's narrative of the experience and to contextualize what happened and how the experience has been internalized. She identifies the core negative emotions that are fueling the trauma, thereby laying the groundwork for the healing process.
Well, I just want to be the strong one, but I have my waves that I go through, and that's hard.
So now Dr. Tobia zeroes in on one pivotal emotion, a key knot in Marbeth's intricate trauma tapestry, and she's ready to untangle it with NET. In this first part of the intervention, we will see Dr. Tobia utilizes the technique's muscle biofeedback tool and Chinese acupressure pulse points to guide the process.
So just think about him. You don't have to use your words, just think about him. I'm gonna have you remember how we do this?
Yeah.
You're gonna hold your arm up, I'm gonna put my hand on your wrist, right? We're gonna talk about what's going on in the present day.
So at this seemingly straightforward moment with Marbeth, as a mind-body practitioner, Dr. Tobia is doing much more than just talking. She's also skillfully using the body's autonomic reflex system with the muscle test to assess aspects of the narrative that are troubling or incongruent to Marbeth's well-being. Much like a polygraph reflects the autonomic nervous system's congruence to answers given to questions.
And let's take the concept of the original event in your life in which there was yearning to be cared for and to be taken care of, but not having the support you needed. And let's check the concept when you were conception, so the moment you started.
In addition, Dr. Tobia is using Chinese acupuncture pulse points to both aid in the assessment and incorporate the body's energetic healing system in the healing process. To multitask these skills requires years of training and practice in both Western and Eastern traditions, which Dr. Walker's NET training program provide.
In NET, what it does is we use those meridian points while we're focusing on the stress, so that we're actually using pulse points on the wrists to help the patient process the trauma. And when you treat the mind and the body at the same time, the body is able to regulate in a deeper way.
So engaging the acupuncture meridians from traditional Chinese medicine along with talking about the event, and it seems like bringing up the emotion of the event, doing all of that together, that has a synergistic effect then.
Absolutely. The yearning is sort of like wishing or wanting or longing. What do you feel like in that relationship that you're yearning for?
I think more understanding.
And what's
And
the
just somebody to take care of me.
Someone to take care of you. And what's the hardest part for you about not having someone to take care of you?
And I feel that I'm not able to take care of other people.
So when there's a big event like Marbeth experienced, does the degree of stress and distress have anything to do with then previous experiences or previous traumas that maybe weren't reconciled?
Absolutely, because these previous experiences set a threshold. And so you're more vulnerable if you've had earlier experiences that were also stressful or that were similar in some way. So that those early experiences actually shape how we cope later on in life.
And I remember feeling a lot of resentment that she wasn't taking care of my father, I thought, the way she should.
So she was able to explore some early experiences that had been stressful, obviously not as traumatic as what happened in the present day, but times when she also felt like she didn't have permission to have her own feelings, and that when she wasn't able to process stress in an earlier experience because
They weren't reconciled.
Exactly.
She had experienced them, time went on, but there was an aspect of them that were stuck, so to speak.
Absolutely, and she was stuck in those experiences, and when we went back there to talk about them and explore them, she still had the same memories and the same feelings as if it were happening right now. And when she was stressed, she actually couldn't move her knee very much. She was having pain in her knee.
I had a knee replacement in January, but the other knee now, actually since all this trauma, has been acting up, and I've been having more trouble with bending it and taking stairs and things like that. I have to be more careful.
As Dr. Toby unravels layers of childhood traumas kicked up by the present day, there's still work to be done. What we see in NET is that old unresolved traumas that have a similar flavor in any way to the present day get ignited and compound the burden of the current situation.
I just feel so guilty. I can't make it better. I can't bring him back. I can't.
It's okay to cry as long as you let him go.
I'm so sorry.
It's all right, take it, try, no, let it come, don't fight it, let it come. Let it come. You're so
You
sorry.
did
I know, I'm sorry.
And step by step, Dr. Tobia uses NET to help Marbeth process the emotional distress of this very significant trauma.
Because your mind, it's sort of like this open loop that your mind keeps playing over and over again. How could this have gone differently? What could have been done to make this different? And it sounds like on the one side, you have this medical piece that says there's no way this could have been any different. Once the exposure happened, it was already too late. And then you've got this other mommy emotional part of your brain that thinks there had to have been something I could have done.
We had talked the day before, I guess. My son had called. We had talked to him about Father's Day. I said, I'm having trouble with air printing, and we just couldn't get it to print from the cell phone. He says, I'll help you with that right now. But my husband, he wanted me to do something else with him. And my son right away said, oh, that's all right, Mom. Well, I'll call you later and we'll do it together. Well, we never had it for later.
As you might start to notice, even within this short hour, Marbeth's emotional landscape has changed. She's still grappling with loss, but there's an underlying calm that's new. We've seen similar transformations countless times. For example, we found in our study of cancer survivors that when there was an unresolved trauma, say from getting diagnosed with a deadly illness, or some awful aspect of the treatment, that it got in the way of being free to be happy to be alive. The good news is that our published research in the prestigious Journal of Cancer Survivorship shows that just 3 to 5 NET sessions can resolve the whole thing and change the way the brain and body function.
It's okay to heal. Take the time that you need.
He would always call when he was alone in the car. Maybe only had, 5 minutes or 10 minutes, but it didn't matter. Just check it in, just want to say hi.
And what I love about this treatment is that as we're working it through, these wonderful memories come to the forefront more.
They do, and I thank you for that.
Following the session, Marbeth also experienced significant physical transformations.
She had greater range of motion following the treatment because she had released that stress.
We used to talk about a mind-body connection, but we now know mind and body are the flipped side of the same coin, and that's something that you experienced right here, because when we have a big amount of emotional and traumatic stress, it affects the body, and it often affects the vulnerable parts of the body. And we see that all the time.
I was far more relaxed, and I could bend it back much further.
This is terrific. I can't thank you enough for coming in and just sharing this entire experience with us. I think it's going to help a lot of people.
Thank you.
This great example underscores an application of the Neuro Emotional Technique where a distressing life event can really be neutralized to a large extent. Now, in this case, Dr. Tobia led her through the process. But we all have things we face in our life that cause us distress, maybe not at this magnitude, but everyday life things, whether it be an altercation at work, a difficulty navigating a situation in a relationship, where we're feeling feelings and thinking thoughts that feel intense, and we want to do something about them. Now, many of the things that we often talk about can make a big difference, such as meditation, just taking a few minutes to breathe, getting enough sleep, eating healthy and balanced, even when you're feeling distressed, because oftentimes there's a pull to do the opposite. All of these things can help us navigate our life stressors. In addition, NET teaches a self-technique to help you with those smaller life events where you're feeling some distress and you want to help yourself move through it. Here's how it works. So as you might recall from Dr. Tobia working with the patient, there are these pulse points along the wrist that get activated as they're doing the breathing techniques. Say there's a life event. I'll think of one for myself. Maybe somebody at work who just rubbed you the wrong way. You're having a hard time letting it go. So think to yourself, what am I saying about this event? What emotion am I feeling? Whether it's anger, fear, but make sure you name the emotion. What am I feeling? And if you're not sure, just do your best to describe it so that you can have a name for the emotion, a sense of what you're saying to yourself, and then also check in with yourself. Where do I feel that in my body? And when you have those 3 things, then here's the technique. Keep those 3 things in your mind as you stimulate the points on the wrist. Here's how. So you're going to put the palm of your hand and start either side you want on the wrist, right where the face of a watch would go, and let your fingers curl around, with the first 3 being the most important, and your forefinger is touching where the actual pulse would be, and then just place the other 2 right next to it. Then we're going to make sure that we put the hand across the forehead like this, because that allows us to touch the emotional points on the forehead. And make sure that you then sit comfortably. Always let your elbows go down as you take some nice deep breaths, just like this, as you're thinking about what you're saying about the event, the emotion that you're feeling, as you're breathing it in and out. And do that for 4 or 5 nice deep breaths. Then you're going to switch sides, and again, put the palm right where the face of the watch would be, curl the fingers around. Your forefinger is touching where your actual pulse would be. Then have your other fingers just go right next to it. Keep thinking about what you're saying, what you're feeling, where you're feeling it in your body. Let the elbows relax. I like doing it at a table like this, so my elbows can just be relaxed. I can hunch over, having my hand across the forehead, taking 4 or 5 deep breaths as I'm thinking about that. And you can do that up to 2 or 3 times. And what most people notice is that the intensity of whatever it is subsides to some degree, shifts to some degree. Whatever the experience for you is great. Sometimes the emotion even wells up a little bit more as they're breathing, and then it subsides. But it helps you to stay connected to yourself and also allow the energetic circuits of the body, according to the traditional Chinese medicine system, to help with the processing of these distressing events. So I think you'll like this new tool. Give it a try. And remember, there's so many things we can always be doing to make our mind-body health just a little better. I'm Dr. Dan Monti. Until next time, be well.